Hi, today I want to be sharing with you 5 signs that could be indicators that you are going to be having diabetes. Knowing these 5 signs could be your lifeline in order to prevent diabetes altogether or to detect it very early so that you could have a relatively normal lifestyle. Straight off the bat, I'm going to be giving you all 5 signs. So if you are looking for more details on what those are and how it works, stay tuned, and at the end of the video, I'm going to be giving you an additional 5 signs to look out for just to be safe. So here are the 5 main symptoms you should be looking out for. First is the 3P, Polyphagia, which means extreme hunger. Despite just eating, you still feel hungry. Second is polydipsia, which is extreme thirst. No matter how much you drink, or you need to be drinking an unbelievable amount of water just to quench your thirst. And third is polyuria, increased frequency in urination. This is especially bad if you have something called nocturia, which is increased frequency of urination at night after you go to bed. So the next signs to look out for are slow wound healing and frequent urinary tract infections. So for those of you who are just looking for the 5 signs, these are the 5 signs. And for those who want to know more, let's get to it now. To explain this as simply as I can, diabetes is the inability of the body or the failure of the body to convert circulating glucose in the body into storable and usable form of glucose, which is called glycogen. When this happens, the amount of glucose in the blood is going to be very, very high. And this leads to the first symptom we talked about earlier, polyphagia. When all the energy which is supposed to go to the cell is circulating in the blood because the body can't really convert them, the cells start starving. And this is why the cells constantly send signals to the brain saying that you are hungry, because they are not getting the energy that they are supposed to receive. Next, when the blood is so saturated with glucose, the circulation is going to be slow. And to make the situation better, the body will start sending more fluids into the circulation, into the blood circulatory system. And when this happens, the cells are going to have less water. This is why you constantly feel thirsty. And regardless of how much water you drink, you will still feel thirsty because your body is not getting the water which is supposed to go there. Usually when the kidney produces urine, it will recollect back or reabsorb the sugar inside the urine to send it back to the circulation. This is so that we constantly have a source of energy. But in cases where the patient already has diabetes, the concentration of glucose inside the blood is going to be so high. So this means the kidney will have to work super hard just to produce urine. So this is why the kidney is constantly working and the patient has constant frequent urination. Because the blood circulatory system is so saturated with glucose, the circulation becomes very poor. You can try imagining, for example, a drain filled with sludge. That's how slow the blood will start moving. Because of this, in case there's a wound, especially in legs, in the toes or in the knees, which is very far away from the central part of the body, it takes a longer time for the blood to deliver the necessary nutrients and components for healing to happen. This is why in patients with diabetes, the wounds often heal very slow, or in some cases, they don't heal at all. As for why urinary tract infection is very common and very frequent in diabetic patients, is because high sugar levels is a very favorable environment for bacteria and microbes to grow. This is why these patients often have frequent visits to the hospital for urinary tract infection. And as promised, an additional 5 symptoms to look out for. First is unusual or unexplainable weight loss. That means you're losing weight without actually exercising or dieting. Next is blurred vision. Third is fatigue or extreme weakness or feeling of extreme irritability. Fourth is tingling or numbness in your extremities, especially your legs. You feel numbness or tingling sensation in your legs. And finally is erectile dysfunction or impotence. And those are the 5 signs that you have to watch out, that if you have, you might be very susceptible to being a diabetic patient. And as usual, if you learn at least one new information in this video today, all I ask is that you share this with a friend or family member so everyone can learn something new just like you. Do not forget to subscribe and click the bell icon so that you do not miss out on health tips every weekday which we post. And until the next informative video, in anything you do, do your best and be the best version of yourself. Bye bye.